felt like my head was going to explode all over the room.
When you have so many people telling you there's nothing wrong with you.
She said it was like someone driving a spike into her head with a hammer.
My fear was that it would be something that would wind up killing her.
Next, two medical mysteries that defied the experts. Amanda Kovler could never have prepared herself for the onslaught of agonizing pain that would leave her unable to walk, let alone take care of her children. And after every doctor dismisses her crippling symptoms, she begins to question just how much more she can take.
I felt like if I have to live the rest of my life like this, I don't know that this is the way I want to live.
And Linda Vola, an active woman her entire life. In a matter of days, she is overcome with crippling pain and vertigo, and no one can figure out why.
I actually had to help her walk out of the house. This was not the Linda that I knew.
Then, in January 2003, Amanda and her husband Ira decide to try for a second child. But their plans hit a devastating roadblock when Amanda loses back-to-back pregnancies.
She would have a pregnancy that would begin, and then 6 to 8 weeks into it, she would miscarry and we would lose the baby.
The first time it happened, it's not that uncommon, and I didn't think anything of it, and then it happened again.
It was always, very sad. I tried to be as supportive as I could for Amanda.
On the heels of 2 miscarriages, Amanda decides that it's time to check in with a reproductive endocrinologist. After performing a thorough exam, he's confident that she's suffering from polycystic ovary syndrome, a common condition that can cause infertility. He assures Amanda that it doesn't mean she can't have another child, but getting pregnant will be tricky.
He felt that I just wasn't ovulating well. He put me on several medications to help the ovulation increase.
Amanda diligently takes the medications and prays that they'll work. Then, just 4 months after starting the regimen, the doctor has some good news.
We got pregnant and it stuck, and so we were very excited.
Overjoyed, Amanda and Ira begin preparing for a new baby. And in May 2004, Marissa Kovler is born.
She was wonderful and a beautiful, healthy baby.
But as the family adjusts to having a newborn in the house again, Amanda is finding it far more difficult to recover from the birth than she expected.
Everybody's tired when they have a baby, but I felt worse than I did with my first daughter. I was extra tired. I was having really bad headaches, and I didn't understand why that wasn't going away.
She just seemed to get weaker and not have the energy to deal with taking care of the 2 children.
When I went to see my OBGYN for my checkup, he said, oh, it's just you have 2 kids now, and so you're just feeling tired, but you'll feel better, so don't worry about it.
Hoping that the doctor is right, Amanda makes an effort to get more sleep and begins taking various over-the-counter medications to dull the pain. But 3 weeks later, the headaches only seem to be intensifying.
It was mainly the top of my head here on either side, and it would never go away.
She said it was like someone driving a spike into her head with a hammer.
The pain is so persistent that it soon becomes a struggle just to get out of bed in the morning. Then, 3 months after giving birth to Marissa, a bizarre new symptom emerges.
But when Linda Vola started feeling aches and pains, she assumed she was just overdoing it, much like her husband.
Charlie was working so hard. He would travel, he'd come home, and he just wouldn't feel well.
I was having some joint pain and some muscle pain, lower back pain, but I figured that was just normal condition for my age.
You get old, you get aches, you get pains.
Charlie is determined to stay active, but later that year he goes on a business trip and falls ill.
I was coming from Lima, Peru to Bogota, Colombia, and I got to Bogota and I was ill for 3 or 4 days in a hotel room in Colombia, just in terrible shape.
And we'd start saying, you're getting old, you gotta watch out, you can't do too much, and we'd keep doing it anyway.
Although Charlie is struggling with his health, Linda seems to be in better condition. Until they go on vacation that fall. Suddenly, Linda experiences an unusual pain that she's never felt before.
I went to get off the plane and I couldn't get up out of my seat. I had such awful, awful pain in my lower back, in my hip area that Charlie almost had to carry me off the plane.
When I heard that she physically could not move the lower half of her body, I was nervous, but at the time it was just pretty much an isolated experience.
But the pain doesn't go away. It gets worse. And later that week, Linda makes an appointment to see her doctor.
And he said, oh, you probably just strained some muscles. You'll be fine. Just relax. Go away. So I probably waited about a month, and the pain was not going away.
So she was thinking that the back problems that she was having could be corrected by going to a chiropractor.
And he would do massages in the area, do a little electrical stimulation.
Linda visits the chiropractor almost every week for 3 years. It brings her some relief from the agonizing pain. Then, one day, on her way to visit a friend, something alarming happens.
I started feeling just very strange. It was dizzy and off balance. And I'm driving the car. So I just concentrated. I got myself home.
She went to bed early that night, and that was the end of it, and we figured that in a couple days she'd be fine.
I noticed that I have these scaly, dark patches of skin on my cheeks. When I put my foundation on, you could see a dark area where that area of skin was drier than the rest.
Even more strange, her family begins noticing other dramatic changes in her appearance.
One of the first things that actually attracted me to Amanda was her beautiful hair, and it was very dry and brittle, and didn't look like her hair used to look at all.
It became frizzier and frizzier, and I just ended up just pulling my hair back and wearing a ponytail every day.
But just when she thinks it can't get any worse, Amanda begins experiencing a new and extremely agonizing symptom.
She just started really complaining about how terrible her knees were hurting. That just kind of came out of the blue.
Amanda tries a series of home remedies hoping to alleviate the excruciating pain, but none of them seem to work.
I was popping over-the-counter pain medicine. I would sit in hot baths to try to see if the hot water would somehow help, and I would put anti-arthritic creams on my legs. Nothing helped.
The constellation of mysterious symptoms eventually becomes so bad that Amanda is forced to quit her job.
She went from being a mother that worked full-time to being a mother that was completely exhausted. It just seemed like she went downhill pretty quickly.
It hurt so much all the time that I just felt like I couldn't move. Every day of my life, I was in pain.
Alarmed, Amanda's family insists that she visit her primary care doctor.
He said, oh, well, maybe you're experiencing a little bit of depression. It's very common at the 6-month point after having a baby to experience postpartum depression, and I think you're taking a nosedive into that. I told him, I'm like, well, other than being depressed over the fact that I'm feeling so poorly, I don't feel like I'm a depressed person. And I felt very alone, and I felt very misguided.
He gave Amanda some antidepressants, basically just to kind of push through it.
I did take the medicine because I didn't want to discount what he said. He was my doctor.
She did not get better. It did not change.
So I went to see my doctor.
Linda's doctor suspects that she has an inner ear infection. The inner ear contains the mechanism that keeps a person balanced, and when it's injured, a patient can experience dizziness. The doctor immediately starts her on a course of antibiotics.
She said, if you take that, it'll go away very soon.
And it just wasn't going away. And I think that made her nervous.
Amanda continues to take the antidepressants, but after 8 weeks, she still isn't feeling any better. Tormented physically and emotionally, she's beginning to feel like she's reached the end of her rope.
I would watch my children play and wish that I could be there playing with them. I would just lay there and feel so miserable that I couldn't do anything.
I supported her in her decision to follow the doctor's advice, but I really didn't think that was going to do anything to help her.
Ira Kovler, Amanda's husband, is so worried about his wife's fragile condition that he sets up a series of appointments with an ear, nose, and throat specialist and a neurologist to get second opinions. But both doctors assure them that there's nothing physically wrong with her.
It was heartbreaking. The person who I loved and who I know is such a wonderful person couldn't do the most basic things that she wanted to do to enjoy her life. And I felt like I had let her down because I couldn't fix it.
After taking the antidepressants for 6 months, Amanda still isn't seeing any improvement. Completely frustrated, she checks in with her primary care doctor once again.
I went back to my doctor and I said, look, I'm not taking this pill anymore. This has not helped me at all. I need you to find out what's wrong with me. And he said, if that didn't help, then I think you have fibromyalgia.
Fibromyalgia is a chronic condition typically characterized by extreme muscular pain, fatigue, and depression that afflicts women more than men. Because there is not one specific way to test for it, the diagnosis is sometimes a catch-all for a variety of disorders.
I think that my doctor was getting tired of hearing me nag him about what was wrong with me, and I think that that's why he chose to label it as the fibromyalgia. He's like, you fit the perfect age for it, childbearing years. There's nothing to be done. There are a few fibromyalgia pain centers that are popping up. You can, investigate one of those if you like, but I'm telling you that that's what it is, and you might as well learn to live with it.
The drugs don't help Linda, and within 2 weeks, the dizzy spells are accompanied by intense headaches.
They would kind of come and go to the point where they felt like they were with me all the time. And it was a pressure headache. It kind of feels like, your head's expanding.
Amanda can't bear the thought of having to live with this pain for the rest of her life and is not ready to accept that she may have fibromyalgia. At this point, of all her symptoms, the knee pain is the most excruciating. She decides to take matters into her own hands and visits an orthopedist to get a second opinion.
I had knee x-rays done. I had a full back MRI. And when I went in to see the doctor to give me my results, I was very shocked when he said to me that everything looked great, everything looked fine. When you have so many people telling you there's nothing wrong with you, you start to feel crazy.
Dismissed by yet another doctor, Amanda and Ira simply can't understand why no one is taking her pain seriously.
With each successive doctor, we would have more and more documentation of the tests that had been done. And each doctor, I think, was intimidated by it and would look at it and say, I can't solve this problem. I don't see anything wrong with you.
But Amanda and Ira refuse to back down. They begin scheduling appointments with a new round of specialists, including a rheumatologist and an endocrinologist. And yet again, all of the tests they run come back normal.
I was just so tired of everyone saying, learn to live with it, you're getting older. I just wanted to know what was wrong. I was in constant pain. My head wouldn't stop hurting. I felt like, if I have to live the rest of my life like this, I don't know that this is the way I want to live.
My fear was that it would be something that wouldn't be diagnosed properly and would wind up killing her.
The headaches are almost constant. And 6 weeks after they begin, Linda has an especially scary episode.
She was curled up in the bed, almost in a fetal position, and looking frightened.
It felt like my head was going to explode all over the room.
You can look at a person and see in their eyes that it's time to go to the hospital. When the fright is there and they don't understand what's going on with them, and they know it's not going to get better.
So he rushed me to the hospital, and they immediately give me a CAT scan. With such a bad headache, they wanted to make sure that I wasn't bleeding in the brain. I thought at that point that maybe I had an aneurysm or possibly some type of a tumor.
You start to think that, well, maybe this is something really bad. Maybe this is a brain tumor. And that was a little bit frightening. It was frightening for her and for me.
Amanda soon becomes consumed with finding out what's been wreaking havoc on her body. After seeing a variety of specialists and getting nowhere, she decides maybe it's time to find out more about fibromyalgia.
Well, I was getting fed up, and that's when we decided to contact one of the fibromyalgia and fatigue centers around town.
Amanda tracks down a clinic in her area, and 1 week later, she and Ira go to meet yet another doctor.
We went to see this doctor. He said the magic words, "What you say is legitimate, and I will treat you, and I will help find out what is wrong with you." And that felt so good. Here was someone willing to listen to me.
As he begins performing a head-to-toe examination, Amanda is hopeful that finally someone will be able to help her.
He says that I don't exhibit all of the pain points that someone with fibromyalgia would, that he does think it is something else, and he took 30 vials of blood and tested me for everything under the sun.
He's confident that when the wide array of test results come in, he'll be able to pinpoint just what's been triggering the chronic symptoms. In the meantime, the doctor directs her to take a daily regimen of 51 pills to help control her fatigue and pain.
I thought that the 51 pills was incredibly excessive, both prescription and herbal supplements, and I didn't know what that was going to do to my body. I was worried, okay, am I going to die from taking 51 pills?
It seemed a lot to me at the time, but if it helped her any, that was fine with me.
None of those medications or treatments or blood tests were covered by the insurance. We spent tens of thousands of dollars on that treatment.
If anything could make me feel better and make me get off that couch and just spend more time with my family, I would do it. I was so desperate.
3 weeks later, the test results come back. But unfortunately, they don't reveal anything significant, and Amanda and Ira are crushed.
The blood work ruled out a lot of things, but nothing was ever diagnosed from those blood results.
While the test results are inconclusive, the doctor assures Amanda that if she continues to take the pills, she will eventually feel better. And sure enough, 5 months later, Amanda is overwhelmed by a shocking new sensation: relief from the pain.
My symptoms disappeared, and I was just ecstatic. And my husband is like, oh my God, here is the woman I married. You know, you haven't even been the same person this whole time, and here you are again, and, you know, it's nice to see you.
Thrilled to finally feel like her old self, Amanda is hoping that her mysterious illness has gone away for good. But a week later, she's hit by a symptom she's only felt twice before in her life.
The only time in my life I've ever had heartburn was when I was pregnant with my 2 kids. And so I had an old pregnancy test, and it came out positive. And my first reaction was to freak out, because here I was taking 51 pills a day that I didn't even know really what they were.
She comes out of the bedroom crying, and I'm looking at her like, what's wrong? And she says, I'm pregnant.
What am I gonna do? I'm taking all these weird drugs, and what is it gonna do to the baby? And I'm so scared.
I was happy and at the same time very concerned. I didn't want Amanda to have another miscarriage and lose another baby. We made an appointment to go see the reproductive endocrinologist, and he did his exam, and she was in fact pregnant and doing well.
To their surprise, all the tests come back negative. The doctors can't find anything wrong with Linda, and they send her home. But over the next month, the dizziness and the headaches get so bad that Linda is forced to quit her job.
Things change pretty drastically. Just the general day-to-day thing. Driving a car is out. A lot of people ballroom dancing, gone. Just normal going for a walk is difficult.
She had a cane. I had never seen her like this. This was not the Linda that I knew.
Her life, it wasn't cut in half. It was cut down to 10% and fast.
Amanda breathes a huge sigh of relief and then informs her doctor about all the pills she's been taking. He instructs Amanda to immediately go off all of the medications and supplements. Over the next few months, Amanda is feeling better than she's felt in a very long time, and the baby seems to be healthy as well.
It felt like someone turned on a light switch. I went from this pathetic person laying on a couch in pain all day to just myself again, and I felt just so much energy, and I knew that that's how I was supposed to feel. That just proved to me, okay, you weren't crazy.
We did all kinds of activities, started eating out more, going to movies. She was completely pain-free.
Amanda is overjoyed that all of her unbearable symptoms have vanished, but wary of what might happen after she has her baby.
In the back of my mind, I was thinking to myself, well, what if it comes back? I can't take it if this comes back.
We began to wonder, how can this be that when you're pregnant, you're healthy, and when you're not pregnant, you're sick? I can't keep you pregnant forever.
Linda and Charlie decide to go back to her doctor. He immediately refers her to Dr. Reed Lockman, an ear, nose, and throat specialist.
I saw Linda back in the fall of '04, and she came to see me with basically feeling dizzy.
Dr. Lockman is troubled by how long Linda's dizziness has lasted.
Somebody who's relatively young and healthy shouldn't have it for a couple months, and it shouldn't be so disabling to you. So I had concerns. I really was concerned.
Dr. Lockman also orders another round of tests. None of them show any abnormalities, until he gets the results of the MRI.
It did show some inflammation in the hearing nerve and then the balance nerve that was in the brain, and that was, again, perplexing as to what it could possibly be.
The MRI suggests there's an inflammation in Linda's brain, but it doesn't explain why.
In January 2007, Amanda gives birth to a healthy baby boy, Jake. But just as they feared, Amanda's harrowing pains return with a vengeance.
3 months after having the baby, all my symptoms came back. The day that I felt my first ache, I was just crushed. I was like, please, no. It was like a nightmare.
Amanda and Ira are completely devastated. Not only is she struggling to live with the excruciating headaches and knee pains all over again, she's now barely able to take care of their 3 children.
My children would want me to come tuck them in at night, and I could not walk up the stairs to do it. I would struggle to take a few steps, and I'd be like, I am just too tired, and I am in just too much pain to do it. Everything was falling on my husband, and I felt so guilty.
But the Kovlers promise each other that they will not stop looking for answers until someone makes a solid diagnosis. They begin by setting up appointments with a new set of specialists, including yet another endocrinologist in the area, Dr. Vivian Rodriguez.
Amanda came to visit with her husband, and obviously there was a lot of frustration, anxiety.
Amanda started to tell Dr. Rodriguez everything that had gone on and everyone we had seen and what had happened with all of her symptoms resolving during the pregnancy.
Amanda also hands over her extensive case file that she's been keeping diligently for more than 2 years.
On the laboratory profile, her chemistry was completely normal, but on her thyroid profile, she was having some abnormalities.
When Dr. Rodriguez asked Amanda if she knew that her thyroid levels were wrong, Amanda said that she had noticed that some of the numbers were different, but that she didn't know what it meant. No other doctor really paid much attention to it.
When I found out I was pregnant and I went to the reproductive endocrinologist, he ran some labs on me, and it showed that my thyroid was low. And when I brought that to my OB and I showed him that, he's like, oh, don't worry about it. A woman's body pretty much will naturally adjust the thyroid to meet the pregnancy needs.
This was really pretty much our last shot. We had seen just about everybody else. We had had every blood test done. So if Dr. Rodriguez wasn't going to be able to help us, then we really didn't think there was anything left to do.
So he sent me to a neurologist, and he went like this with my eyes, and he made me walk. But he said it's not a neurological problem. So I went back to see Dr. Lockman again. He kind of shook his head and said, it's something that's kind of beyond what I do.
Whenever you have a somewhat unusual finding of inflammatory changes inside the brain, you have to be suspicious of something a little bit more odd going on.
And he said, you need to go to see an infectious disease doctor.
And when she said that to me, I said, infectious disease? What could you possibly have?
In November 2004, 5 months after her first dizzy spell, Linda meets infectious disease specialist Dr. Leon Smith.
Well, the first thing I did is get a long history. I spent a lot of time getting history. Where you've been, how you've been, where do you live, what kind of water do you drink?
He asked how many people came to our houses, were they from other countries, who visited us often, what trips we had taken.
He said, we will get to the bottom of this. He said those exact words, we will get to the bottom of this. And we knew he would.
And we went all out. Her lab test must have cost her thousands of dollars. And you know, you don't like to run a lab cost like this. But we were trying to find the answer to a very mysterious disease.
But now, 3 years after her first symptoms set in, one doctor, endocrinologist Vivian Rodriguez, suspects she knows what's been causing Amanda so much anguish.
She had dry skin, dry hair. On her neck, felt enlarged. The right side was a little bit more prominent compared to her left side on her thyroid. And then when we checked on her muscles, there was a decrease in terms of the muscle relaxation time. And that's one of the markers that we look for the situation of thyroid diseases.
After going over Amanda's medical history with a fine-tooth comb and giving her a thorough examination, Dr. Rodriguez is confident she has the answer the Kovlers have been so desperately looking for.
After evaluating Amanda and having the interview and reviewing her laboratories and her exam, I was convinced that her diagnosis was Hashimoto's thyroiditis.
Hashimoto's disease is an autoimmune disorder in which your immune system produces antibodies that attack your thyroid gland, a butterfly-shaped gland located at the base of your neck. In a healthy individual, this gland produces hormones that help regulate many of the body's activities, from muscle function to metabolism to reproduction. But in patients like Amanda, The attacking antibodies gradually destroy the thyroid gland, making it almost impossible to produce the hormones the body needs.
Knowing that the thyroid hormones are going to work in all the different systems in your body, not having the right levels on your thyroid, it will basically affect every single function.
Ira and Amanda are overwhelmed by everything they're hearing. Finally, it's all beginning to make sense.
I was like dumbfounded because, number one, these are the same labs I had showed so many other doctors. Number two, she hadn't even done her own workup, and she came up with this diagnosis for me.
I mean, I began to cry. I felt betrayed by all the other doctors I had trusted with this. And I was so relieved that Dr. Rodriguez had finally spent the time to look at this and see what was wrong with Amanda.
Hashimoto's causes dry skin, dry hair. You can have miscarriages and fertility problems. You have joint pain. You have headache. Everything I had was this disease.
Linda's test results are ready.
Dr. Smith starts going through the list. Very interesting.
We went down the line, down the line, down the line.
Pages and pages of results came back on all the tests that he took on me, on some exotic things that I never would have imagined.
And finally, the bottom of the list was the result. And I was skeptical of what we found because it's so rare in this country.
He says, this is very, very odd.
Linda's diagnosis was brucellosis.
Brucellosis is an infectious disease caused by the bacteria Brucella. The bacteria can enter the body through unpasteurized dairy or tainted meat products. Once inside, Brucella invades the cells of the joints, muscles, and nerves. If the disease reaches the heart or brain, it can be fatal. Brucellosis is extremely rare in the U.S., affecting only about 1 to 200 patients a year. It's more common in places like Asia, the Middle East, and South America. It can be spread through blood transfusions or sexual contact.
I was flabbergasted when he told me that I had brucellosis.
She was, in a weird way, somewhat happy.
That was a great day. A diagnosis at last.
Dr. Rodriguez immediately puts Amanda on a medication that mimics the hormones produced by the thyroid gland to start treating her symptoms. As she begins to feel better, Amanda can't help but wonder why the debilitating disorder seemed to simply disappear when she was pregnant.
During pregnancy, a lot of the hormones are going to be enhanced in order to have better function. It's kind of a protective period in order for you not to destroy the fetus. Then after the delivery is when you lose that kind of protection, and the person will become more symptomatic.
Amanda is elated to finally have a diagnosis, but can't shake her frustration that so many other doctors couldn't put the simple pieces of the puzzle together.
It's not difficult to be diagnosed, but the person needs to make sure to be a detective, putting together the situation of the physical findings, the history on the patient, along with the laboratory findings on the patient.
I think it was tricky because no one wanted to see the big picture. Everyone was so determined to say that it was because I was a mom and overburdened, or because I was a woman and my hormones were off, or because I was depressed.
If the diagnosis were not made, she would have been more of an invalid. It is a relapsing disease, goes on for a lifetime.
Linda is diagnosed just in time. The bacteria has already attacked her nervous system, causing her balance problems. She starts on a course of powerful antibiotics, but she still has questions.
It didn't make any sense to me. How could I have this very rare infectious bacteria in my system? I found this article on the internet, and I read every word of it. The first place that this Brucella bacteria goes into is your lower back. And I'm thinking, and I'm going back 3.5 years before, when I couldn't get off that plane. That's when this started.
Suddenly, it all makes sense. Shortly before Linda's back pain started, Charlie was sick in South America. Now Linda wonders whether Charlie could be the carrier.
I don't think Charlie really thought he had it, but the more I talked to him, the more it made him think that it was a possibility.
Charlie agrees to get tested, but first they have to convince Dr. Smith.
He says, statistically, this is almost impossible. So there's 100 or 200 cases a year, 2 people together, same family, almost impossible. But they said, all right, well, we'll test you anyway.
4 months after Linda's diagnosis, Dr. Smith has the results of Charlie's blood tests. And they're shocking.
And Dr. Smith says, we look at your brucellosis test, and your brucellosis is 50% higher than Linda's.
I was very surprised.
The level of bacteria in Charlie's blood tells Dr. Smith that Charlie was the first to be infected.
3 months after being diagnosed, the changes in Amanda's life are remarkable.
Amanda's doing a lot better. Her hair is back to normal. Her skin is good. She still has some pain in her legs and it's getting better. Her energy level is dramatically increased.
The Hashimoto's I will have to manage for the rest of my life. Overall, taking 1 pill a day sounds pretty good. If I hadn't continuously gone to doctor after doctor after doctor, I may not have my diagnosis today. Advocating for your care is the #1 important thing you can do for your health.